questions focused on Borrelia recurrentis, the spirochete responsible for relapsing fever transmitted by the human body louse. Each question includes 5 answer choices, the correct treatment, and explanations for incorrect options. Question 1. Relapsing fever, presentation and diagnosis. A 34-year-old refugee from East Africa presents to the emergency department with high fever, chills, myalgia, and headache that began 3 days ago. He states he had similar symptoms last week that resolved spontaneously but recurred again. On exam, he is febrile and has conjunctival suffusion and hepatosplenomegaly. Peripheral blood smear during fever reveals loosely coiled spirochetes. Which of the following is the most likely causative organism? A. Leptospira interrogans, B. Borrelia burgdorferi, C. Borrelia recurrentis, D. Rickettsia prowazekii. E. Treponema pallidum. Correct answer, C. Borrelia recurrentis. Explanation: this patient has relapsing fever characterized by recurrent febrile episodes, arthralgia, headache, and hepatosplenomegaly, spirochetes visible on blood smear during fever, spread by body lice, common in overcrowded and unsanitary conditions, e.g. refugee camps. Borrelia recurrentis changes surface antigens, immune evasion, recurrent fevers. Why not the others? A. Leptospira interrogans, spirochete, but causes wild disease, renal liver failure, jaundice, via animal urine, not lice. B. Borrelia burgdorferi causes Lyme disease transmitted by ticks, not louse-borne, and does not cause relapsing fever. D. Rickettsia prowazekii, also louse-borne, but causes epidemic typhus with rash and stupor, not spirochetemia. E. Treponema pallidum, syphilis, spirochete not seen on blood smear, causes chronic STD, not relapsing febrile illness. Question 2. Treatment of louse-borne relapsing fever. A 45-year-old man from a homeless shelter presents with high fever, rigors, and mental confusion. He reports multiple febrile episodes in the last 3 weeks that resolve and then recur. Blood smear confirms a spirochete diagnosis of Borrelia recurrentis. Shortly after initiating antibiotic therapy, the patient develops fever spikes, hypotension, and worsening symptoms. Which of the following is the most appropriate treatment, and what is the likely cause of his worsening symptoms? A. Azithromycin, due to endotoxin release from gram-negative lysis. B. Doxycycline, Jarisch-Herxheimer reaction. C. Ceftriaxone, type 1 hypersensitivity reaction. D. Metronidazole, superimposed Clostridioides difficile infection. E. Penicillin G, direct neurotoxic side effect. Correct answer, B. Doxycycline, Jarisch-Herxheimer reaction. Explanation: doxycycline is the first-line treatment for Borrelia recurrentis. However, killing large numbers of spirochetes can cause the Jarisch-Herxheimer reaction, acute worsening within hours of antibiotics, due to release of lipoproteins from dying spirochetes, cytokines TNF-α, IL-6, IL-8, self-limited but can resemble sepsis. Why not the others? A. Azithromycin, not first line for Borrelia. Endotoxin release is more typical of gram-negative rods, not spirochetes. C. Ceftriaxone, sometimes used for neuroborreliosis, but no hypersensitivity here, and not first line for recurrentis. D. Metronidazole, not effective for Borrelia. C. difficile takes days to develop, not immediate worsening. E. Penicillin G, effective for syphilis, not preferred for relapsing fever. Neurotoxicity is rare and not consistent with timing. Let me